Umer, and welcome to Den of Geeks Tech Talks, a show where we talk about technology and its future aspects. The topic of today's discussion is nanobots and how nanobots are going to play an important role in treatment of cancer. About nanobots and their use in the medical field. So the concept of nanobots and their use in treatment of medical illnesses is not something new. It's been around for almost 3 decades. In 1990, American scientist Robert J. Freitas first proposed the idea of using a nanobot as a respiratocyte, as an artificial respiratocyte. So what does that mean? So in 1990, the patients with thalassemia or hemophilia were to be treated with nanobots. There was a concept introduced that a nanobot could act as an artificial hemoglobin binding respiratocyte. So the idea of an artificial respiratocyte was put into work then back in 1990. So the idea was that it gave birth to a new sort of treatment that is called hematology. So in hematology, an artificial nanobot is introduced into the body of patient that binds with the natural hemoglobin present to produce blood, essentially. So other than that, it is used as a respiratocyte in hematology. The nanobots have also been used in other medical fields such as dentistry for regular operations by dentists, such as cleaning or root canal or other regular stuff. But the question is that nanobots can nanobots be developed to a certain extent that it could be available for everyday use for all of the patients? Can nanotechnology or the nanobots themselves could be affordable for the doctors to use in their daily operations or routine operations? That is a question for another day, but today we'll be discussing its potential and how it has been used previously in the medical field, or specifically in treating or diagnosing cancer. So talking about the diagnosis, the nanobots have been used for diagnostic purposes for cancer for almost a decade now. So the way it works is that a nanobot ranging from a size of 1 nanometer to 1000 nanometers is introduced into the bloodstream, where they travel through the blood arteries or the capillaries to search or trace for any clue of beginning cancer forming in any cell or any sort of cell irregulation or deformation, where a potential cancer causing melanin cell could be forming. So the way it works is the nanobot traces the place where a beginning cancer has been forming or cell has been deformed, and it shows that or gives reading to the monitor, and the people observing the monitor analyze the reading that has been provided by the nanobot and how the cancer has been forming or at what stage it is, so that it will be treated timely and the way a cancer deserves to be treated. Like different cancers have different methods of being treated. The potential benefits of nanobots and how it can assist or help in the treatment of different cancers. So in talking about different treatment of cancers, already existing treatments, chemotherapy. So in chemotherapy, radiations are used to target the cancerous areas or the cancerous cells present in the body. But the problem in chemotherapy is that it doesn't specifically target the cancerous cells. While destroying the cancerous cell, in process it destroys the tissues and the normal cells surrounding the cancerous cell as well. That results in overall degradation of health and weakness that has been associated with the cancer patients for a long period now, and that is all due to the radiations of chemotherapy, as they kill off the healthy and normal cells as well, affecting the other functions of the body. So how nanobots can help with that? So nanobots can help the doctors trace and target the specific position of the cancerous cell, where they can help guide the radiations of the chemotherapy process to the specific area where the cancerous cell is growing. So they can target the cancerous cell and help save the natural cells from the disaster or the tissues that were being destroyed by the radiations. So all of these things, the nanobots can help save the natural cell. It can help target the cancerous cells more efficiently, hence overall increasing the benefits or the potential of being the cure of cancer. So talking about the other thing, that is treatment by medicine. So a lot of patients have also been treated by medicine for cancer. The nanobots act as a capsule for carrying the substance of the medicine. That can also that also traces and directly affects the cancerous cell. That helps in the efficiency of the treatment. Not only the treatment is more quick, the recovery is better, and the normal cells are saved from the disastrous effect of cancer treatment. Nanobots and their potential benefits for treating cancer. So there is no doubt that nanobots have been helpful in diagnosing the cancer and helping in treatment. But the efficiency, the level of efficiency that was expected from them is yet not acquired or is yet not achieved. The scientists or the engineers have to work hard to create more efficient nanobots and more efficient nanotechnology that is specifically built for this purpose, specifically targeting the cancerous cells, specifically protecting the normal cells. The doctors and scientists, or the medical researchers and the engineers, need to work together to create nanobots or invent nanobots and other nanotechnology that is efficient enough and affordable enough to be used in cancer treatment for all of the patients. So thank you guys for tuning in. Hopefully you enjoyed the show and you guys also took away some sort of information or knowledge from it. Hope to see you guys next time. Till then, this is Muhammad Umar signing off. Thank you.